or house fire. My CNS say PPPs are on. The nature of injury, possible internal organs due to burnings, just as well as trauma may be involved. Calling ALS backup to 722 Newcomb. ALS backup is on its way. There are firefighters on the scene that just pulled the patient from the burning structure. Patient appears to be unresponsive, wrapped in a blanket with different degrees of burn over the patient's body. Patient wrapped up. Going in, sir, no response at this point. Gonna apply, remove the blanket. C-collar measure from chin to shoulder, secure C-spine. Sir, can you hear me? Can you hear me, sir? Patient is unresponsive. Checking for pulse. I do have pulse. Secure the patient airway. Jaw thrust. Patient airway secure. I do see obvious signs of swelling around patient's airway. And there's soot in patient's mouth with secretion. Using my suction, measure from earlobe to side of patient mouth. Suction patient, turn patient to side, up to 15 seconds. Remove soot. Airway is clear. Teen airway with jaw thrust. I do have inadequate breathing. Gonna go use my stethoscope. One depth valve. Respiration rate 36 breaths per minute. Tachypnea. I do have signs of strata on inspiration. Patient's oxygen level. Room air. 85% room air. Patient's skin is warm and red. Temperature 98.6. Checking for Geiger reflex. No Geiger reflex. Measure OPA from side of air to the side of patient's earlobe to the side of patient's mouth. Patients accept. Begin bagging patient with BVM 15 liters of oxygen at a rate of 10 to 12 breaths per minute. I'm going to ask my partner to take over bagging to see if I can get any history on the patient. Firefighters are gone from the scene. There's nobody here. I'm going to move straight into my secondary assessment from head to toe. Assessing patient head, no sign of trauma or burn. Patient's eyes, non-reactive to light. Dilation of 2 milliliters. No burnings or bleeding from patient's ear. Patient's nose, no bleeding or burnings on patient's nose or ear. Patient's neck, no tracheal deviation. Go ahead, cut patient's clothes, assess patient's chest. I do see second to third degree burns over patient's chest. Assessing abdomen. No distension. Patient doesn't respond to pain as I press in all quadrants. GU 7 first degrees burn, pelvis. First degree burn on patient's pelvis. Upper extremities. Third degree burns on patient's arm. I do see third degree burns as well on patient's leg without degloving. Assessing patient's back. First degree burns on patient's back. Assess patient's vitals further. Patient's blood pressure, 60 over P, signs of shock. Patient's heart rate, 136. Tachycardia, signs of shock. Patient's GCS is 3. Glucose reading, 100 milligrams. As patients continue to be in bag at 15 liters of oxygen, high flow oxygen, at a rate of 10 to 12 breaths per minute. I'm going to assess and treat burns. Removing patient's shirt gently. I'm going to place and cut my sterile sheet and gauze and covers patient's burn, and to stop bacteria or infection from spreading. Patient's arms, extremities, patient's chest area and back. Log roll the patient. Can you assist me as we log roll the patient to the patient's side? Patient's being log rolled, gauze being applied, sterile sheet to patient's posterior where signs of burn. I'm going to lower patient onto backboard, okay, for rapid transport. As patient's being loaded also, I'm going to apply icing to patient's throat to help with swelling in that area. And continue to keep patient warm. This warm blanket. This patient is being loaded to ambulance without lights and siren to the nearest burn center, the San Juan Regional. Patient is going to be reassessed in transport. Reassessing ABCs, airway, free and clear. Patient's breathing. (24 breaths per minute). Patient's skin. No signs of redness. Normal skin. Blood pressure. Blood pressure remain consistent, 60 over pulse. Heart rate. (110), still signs of tachycardia. Patient does not respond to pain. Patients continue being bagged. Patient level of consciousness remains the same. GCS. Patient is still unresponsive. My field impression: unresponsive patient experiencing signs of shock from 1st to 3rd degree burns on different parts of the body. I'm going to go ahead and radio my report as patient is being transported. Med Unit 1, 1823, ready to report. Med Unit 1, 1823, responding to call to residence home for a house fire with patients with 1st to 3rd degree burns and signs of shock. Upon arrival, patient was wrapped in blanket, was just being pulled from burning structure by firefighters. Patient was unconscious with a GCS score of 3, not responding to speech, verbal, no motor. Hot skin, blood pressure was 80 over P, heart rate 130. C-spine was administered immediately. Patient was suctioned for secretion and soothed in patient's mouth. High flow oxygen was administered 15 liters of oxygen, BVM, at a rate of 10 to 12 breaths per minute. Sterile sheets were applied over burns area on a warm blanket to keep patients warm, and icing to patient's throat for swelling. Currently, patient is still unconscious, no signs of pain, patient GCS 3. Blood pressure remains consistent, 60 over pulse. Heart rate 110. Patient's glucose went from 110 to 160, 100 to 160. If you have any questions or any orders for me at this time, we will see you at 11:45 p.m.